Racial Equity Officer, Elise Asbury Payne, and she has a presentation and slide deck for us tonight. So Elise, I'm going to hand it over to you. Thank you for being here tonight.
Thank you, Chair. Okay, so I practiced sharing my screen earlier and it worked perfectly, which means we're probably going to have to try twice now. So if you'll give me a moment. Let's see. Okay, are you able to see my screen?
Yes.
And it's not the presenter notes, but just the slide deck.
Yes.
Fantastic. So it worked well. So thank you for inviting me this evening to present on the work of the Racial Equity Office. I'm excited to be here to talk about the scope of the current work that we're doing, to talk about some of the strategic initiatives that we have planned over the next year, and to answer any kind of questions that you may have about efforts and activities that we have going on. I would like to start off by noting that my approach to DEI work within our organization is to really embed the actions and activities into the DNA of how we operate. So oftentimes that can lead to questions around what exactly do we do? And the answer is a little bit of everything. We support the entirety of the organization and the community with a very small, I would like to say, but mighty team. So looking initially at our internal area of focus, unfortunately, starting off with our ongoing pandemic response, I was hoping that at the last board presentation, we would be talking differently about where we are at in the pandemic. But as of today, we have 114 cases in the last 24 hours within Washtenaw County, at least one staff case in the last week. So we are far from outside of the pandemic. Even with that, the goal is really to look at how do we continue to inform county operations? How do we continue to respond to the pandemic? How do we adjust to the new normal? So in addition to ongoing pandemic response, the REO is participating and leading efforts related to cultural competency, staff engagement. Examples of this would be the Juneteenth acknowledgement that happened for the first time this year, the acknowledgement and observation, and the first acknowledgement of Hispanic Heritage Month by the board. In addition to staff engagement, day-to-day administrative operations, participation in senior leadership, the administrative cabinet, our communications team, and providing ongoing technical assistance and support to all of the departments related to issues of equity, diversity, inclusion, and operationalizing those principles. We've recently launched our first ever county-wide equity audit in preparation for racial equity action plans that we'll bring back in front of the board in February. And I'll go into more detail about that process and what it looks like a little bit further on in the presentation. All of this is really about data-driven decision-making and how do we operationalize and measure the principles related to equity in terms of our metrics and our outputs. Again, having to highlight our ongoing pandemic response and our external operations. The REO works very closely with our health department. We have standing meetings with our communications teams, with the operations teams, and with senior leadership. Director Loveluck and I have a standing meeting with the goal to really look at all of our pandemic response, our external pandemic response through the lens of equity. We focus heavily on community relationship development, learning the unfortunate lessons over the course of the pandemic that Washtenaw County as an institution is really only as strong in the community as our relationships. We provide technical assistance to external organizations, local units of government, and most recently have started working with community around American Rescue Plan engagement. I know Commissioner Maciejewski was at a presentation that I did recently talking about incorporating the principles of equity into our ARPA funding decisions. I want to take this opportunity to really highlight some critical partnerships that we've had over the last year. The county response and our equity outputs would not have been possible without these relationships and without these partnerships. EMU, the Family Empowerment Center, Ypsilanti Community Schools, Michigan Medicine, IHA, WMBK, who helped get supplies out to more than 25,000 households when we were doing essential basic supply distribution in partnership with the Sheriff's Department. The Ministerial Alliance, the Coalition of Pastors, University of Michigan, Ann Arbor Spark, Ann Arbor Area Community Foundation, the Small Business Association, Entrepreneurship Center, WCC, and more than 100 other grassroots community organizations and mutual aid groups. We truly work with all parts of the county at all levels of institution and leadership, from your smallest block club to your largest institution. And that really does speak to the fundamental practice around equitable engagement. Some of the areas that I'd like to highlight in terms of our community engaged pandemic response, speaking very directly to the faith leaders and how we early on in the pandemic received some difficult and critical feedback around how the county was responding. Because of those relationships, we were able to pivot in ways that fundamentally saved lives. Faith leaders from all denominations, from all around the county, participate in that. Commissioner Jefferson has been instrumental in that space. Part of how we've been able to kind of cut through some of the false information that's gone around about COVID has been through those relationships. When we talk about data-driven decisions and the impact of COVID-19, one of the partnerships that emerged from that space produced a research study. We had anecdotal information in the early part of the pandemic around what we were seeing in terms of community impact that was not related necessarily to health impacts. We had the data around who was getting sick, who was unfortunately dying, but there were other secondary impacts that we were seeing from the pandemic that we were not quantifying in our health information. Through this research study, we were able to pull some of that information together and use it to craft pandemic response in real time, not just for the county, but for our community partners. So these are some of the key points that were pulled out of the research study. It gave us critical information related to food insecurity, inability to weather a $400 emergency expense, so financial insecurity, inability to pay for basic necessities, challenges with distance learning, especially in Latinx households, and some of the early indicators related to vaccine hesitancy. If you take a look at this information, in the Black community, we saw some of the highest rates of fatality within social circles. So people who knew people in their communities or in their families who had passed away from COVID. And then if you go immediately over, we saw some of the highest rates of vaccine hesitancy in the same communities of people who knew directly people who passed away from COVID. Because of that, we knew that it was necessary to expand and change our messaging to ensure that we were using trusted advisors, we were using trusted messengers, that we were reaching out into communities that were hardest hit with people who were trusted in those spaces. I'd also like to highlight on this slide that this study helped challenge one of the early misconceptions that was local to our community about why we were seeing disproportionate rates of infection. Although Black households were most likely to engage in social distance practices, we were still seeing some of the highest rates of infection and mortality. This early indicator helped us look at some of the other potential causes of why we were seeing disproportionate impact, things along the social vulnerability scale, but also provided an awareness that we had a disproportionate rate of frontline workers, frontline workers in the community that we were looking at. So staff who worked at Michigan Medicine or U of M, who worked in grocery stores or gas stations, who were delivery drivers, who were not able to work from home in the height of the pandemic and infection, when we had the least information and people were getting the most sick, and really challenged some of the perceptions around people not following the guidance or paying attention to information. It was that people really could not stay home. Again, highlighting that food insecurity, even at this early stage, was going to be an ongoing concern in our community. And something that, as we look to increase pandemic responses and supports, was going to be incredibly necessary to pour more resources into. Coming into the period where we had vaccines available, with an awareness that there was going to be increased hesitancy, as part of the work of the Equity Office participating in Governor Whitmer's racial disparity task force with the state and several of the ongoing work groups, we were getting information locally, but from all across the state around best practices in terms of ensuring both vaccine access and reducing vaccine hesitancy and moving people from the persuadable category to the fully vaccinated category. And one of the key components in that strategy was identifying community-based sites. People were more inclined to get vaccinated if they could go to a place that they already knew and they trusted. And if we lowered barriers to access to vaccination, we were going to see increased rates. So through the initial vaccine access work, our preliminary rates of vaccination in communities that had been hardest hit by the pandemic were not what we wanted to see. And in order to expand access through partnerships with the state, with IHA, with Michigan Medicine, over a course of about 8 weeks, we conducted a series of community-based vaccine clinics and administered more than 3,000 first doses. Efforts, of course, led by our health department, but an ongoing equity team, including our health department, Michigan Medicine, and St. Joe's, really with decision makers and leadership at the table, looked at, so how do we reduce the barriers to getting vaccinated down to none? That was part of what drove the early work related to ensuring that there were translators on site at all clinics for both Spanish and Arabic speakers in our community. In addition to seeing some of the vaccine hesitancy, one of the things that was immediately apparent were ongoing challenges with schools. As you all may be aware, some of our school districts were already struggling prior to the pandemic. I tell people all the time, what COVID did was exacerbate already existing challenging community conditions. Ypsilanti Community Schools has had a monumental task in both providing support to their families and meeting learning goals for students. And the county was an instrumental partner in terms of infrastructure and setting up backbone support to ensure that as Ypsilanti Community Schools looked at creative ways to provide learning environments, but also to meet the needs of frontline workers and families who, again, were not able to stay home, who may have had young children, who distance learning was not appropriate, that there was an option and opportunity for them to be in a safe space to learn. The model that was created in that partnership with Ypsilanti Community Schools, WCC, EMU, the Collaboration for Change, and again, Commissioner Jefferson, I would like to highlight his direct involvement in a lot of that work, is being duplicated by the Park Ridge Community Center as an ongoing project based upon some of the successes and the lessons learned in that space. One of the other areas that we know that our community struggled in immediately had to do with our small businesses. And through a series of partnerships that included Ann Arbor Spark, the Small Business Association, Entrepreneurship Center, and the United Way, the Equity Office was involved in and supported both the design and administration of multiple rounds of emergency business support and direct support to nonprofits. I believe we put out more than $4.5 million total over the course of all of the programs. This particular effort, I think, is one that I'm most proud of because it represents some of the most grassroots engaged work that we've done. Prior to the CDC issuing guidelines around the importance of stronger, sturdier masks, the county, in partnership, it was the Health Department Equity Office Administration sat down and said, we think that this is going to be something that we're going to want to do. And either we can pay for it ourselves, which thanks to the board support, there were resources available to do. But the state had rolled out a program that OCED was able to access, allowing us to request KN95 masks. Over the course of this effort, we've requested more than 1 million masks, and through more than 100 community organizations, grassroots organizations, mutual aid groups, block clubs, book clubs, poker clubs, neighborhood associations, faith-based community groups, small businesses and nonprofits, those masks have gotten out into the community and out into the street, really ensuring that not only are wearing masks normalized in our community, but they are easily accessible pretty much anywhere you could possibly want to find one. All of these efforts happen while there's still the internal county operations that are not necessarily pandemic related. The MAG compensation study that you received a presentation on yesterday evening, the Equity Office participates as part of the strategic team and as member of several of the work groups in the space to both figure out our operationalizing and implementation of that of the compensation study. Again, mentioning the administrative communications team. If you see a press release coming out of administration, the Equity Office has participated in helping to make that happen through work led by the administrator's office. And I want to highlight the resolution process because this is a question that I know that Peter Lindeman has asked me a number of times. Through the board resolution process, there is an equity review that happens. Depending on the request from a department or administration or commissioner, the review may be cursory. We look over it to make sure that it falls in line with the technical scope of the organization, that it is appropriate to move forward to the board, or it can be as in-depth as a detailed financial analysis and line-by-line review, depending on what the resolution is. If it is something that is mandated service, if it is formulaic in nature, if it's kind of one of our standard things that we move annually every year, or if it is something that is different and outside of the scope of normal operations. However, that being said, when commissioners see a cover memo, generally the equity section has not been written by the Equity Office. It has been reviewed to ensure accuracy and that there are no components that are factually incorrect. But unless it is coming directly from the REO, it is not something that we would like to be credited with writing. So if you have any questions there, happy to talk more about that. So again, our outward facing operations activities, ongoing, Governor Whitmer's COVID-19 Racial Disparities Task Force have participated since its inception in several of the work group spaces as well. One of the pieces of work that I'm most proud of over the last year, the governor signed into law a executive rule requiring that all health staff, all health system staff, all healthcare providers in the state of Michigan receive implicit bias training. And that was actually something that came out of a work group that I participated directly in. And so in talking about that work, I would encourage you all to have Washtenaw County take partial credit for that, because we are the first state in the entire country to have that kind of requirement for our health system staff. And I fundamentally believe that it is one of those things that will create generational impacts in terms of how people access care and their experiences when doing so. Crystal Campbell in my office participates and represents the Equity Office with EMU's Community Engaged Council, and I know that Commissioner Sanders is also in that space. More recently, involved in the Language Access Task Force. I represent the Equity Office as a commissioner on the 21st Century Policing Commission, working with the Sheriff's Department. And that has been incredible work that I also think will create some fundamental change, progressive change in terms of how our Sheriff's Department operates within our community, and also what it means for law enforcement across the country. Speaking towards some of the technical assistance that the office provides, the Ypsilanti Race and Equity Task Force has recently been formed, and we play a supporting role in that space, really trying to help the Ypsilanti community and the mayor that are participating in that and leading that work, operationalize some of the lessons that we've learned at the county as appropriate and fitting for the efforts there. So moving into 2022, because that work, while impactful, is mostly looking backwards or where we're currently standing. And I would really like to spend some time focusing on what the next year is going to look like. As I mentioned earlier in my presentation, the county is currently involved in a organizational-wide equity audit as part of our racial equity action planning process. Additionally, we've recently formed an equity liaison program to expand on some of the cultural engagement and cultural competency work at request of staff. We've also launched an exploratory committee on reparations, which I will speak more about. And our most aspirational project, our guaranteed basic income pilot. So speaking towards the countywide equity audit and action plan, we're currently in phase 1 to 2. Department leadership has received an initial assessment tool, and the staff, which I believe some of you commissioners have as well, although I'd ask that commissioners do not fill out the staff survey, although there is a community survey that I'll be happy to share with you that you should please complete. So in phase 1, department leadership has received a long form assessment. It is a 14-page comprehensive assessment asking departments to give their snapshot point in time about where they currently are in terms of equity efforts regarding priority policy and operations within their departments. Some departments are much farther along in their work than others. And what we're trying to gauge is organizationally, what is our baseline? Where are we currently at? So that as we look towards how to affect change and how to measure success, we have a working place to start that measurement from. Phase 2 involves labor leadership receiving a similar assessment because we want to get different perspectives from the department. And while we believe that department leadership has an excellent idea of where they feel like their department is, we also think that labor leadership has a different and valuable perspective to add to that conversation. There's a community survey that went live as of Monday. And we're hoping to gather 5,000 responses, although more would be fantastic. The community survey is designed to get a general sense of attitudes and awareness in the broader community, not just related to the equity work, but overall county operations and services. It will be helpful to have a sense as we're moving through this current phase of the pandemic and have had a number of different kinds of changes related to service provision, what the community experience is in this space. Phase 3 takes all of the information, the staff survey, the community survey, the assessments from department heads, and the assessments from labor leadership, and compiles that into a countywide baseline report and racial equity action plan. So the department leadership has received their initial survey. They have until the 15th to complete it. We've done a series of one-on-one meetings with them to provide technical assistance and support to make sure that they have what they need in terms of understanding the purpose of the survey and the tool, to understand what it's going to be used for, and how it can be beneficial in terms of participation and transparency. The staff survey is fully anonymous. And I felt like this was really important to ensure that we receive transparency from staff in their opinions and perspectives about their experience and where the county is in relationship to race, to diversity, to equity, to inequity, and some challenges and some places that we may have to learn and grow. I can say that after reviewing some of the preliminary results from the staff survey, while Washtenaw County is an amazing organization, there are some deep pockets of inequity and concern that I have as related to how we move the organization forward in terms of cultural competency and staff attitudes related to diversity, equity, and inclusion. The survey is issued that it's been mandatory, although staff can opt out of it. The idea is to gain a comprehensive assessment as much as we possibly can. So staff can decide not to answer any specific question or all the questions, but they do have to complete it. Mentioning again the labor assessment, as Administrator Dill mentioned yesterday evening, the ongoing development and deepening of positive relationship with labor is fundamental to principles and practices related to equity, diversity, and inclusion. And ensuring that that voice is cleanly captured in this process was one of the cornerstone components when designing the equity audit and assessment tools. As mentioned, the community survey is out live. This survey is limited to county residents, but if you are a staff person or if you're a staff person and also a resident, we would like to see both of those perspectives. We did limit it to county residents because there's a certain perspective, I think, that comes from being a person who lives within the community and has the very direct experience of being a community member. Although there are benefits and things that can be gained from gathering information from folks who are regularly in the county, but not necessarily residents, that's a different demographic in terms of information that we're trying to gather at this phase. So phase 3, we take all of that information, all of the assessments, the surveys, and that goes into a baseline report. Departments have asked the question, will my information be shared broadly, publicly with other departments, with the board? And the answer is kind of. So we're going to take the lessons and the feedback, all of the trends, and that will be compiled. But department specific information, we're not going to share across the county because we do want departments to feel comfortable to be transparent, maybe about some challenges that they have in their specific unit that they may not want to have shared outside of their individual departments. So that information will come to the board. in a compiled report with recommendations for the equity action plans. So a collaborative process with the equity office and the specific department or office participating, because we do have elected offices, and the courts are participating in this process and have been, I would like to say, exceptional partners thus far. The court, one of the courts was actually the first unit to submit their initial assessment tool. And just want to highlight Lisa Fusick and her team for making that happen. Because this is a new process. This is something we have not done comprehensively together. And so expect to have some kinks and some challenges. And folks have been incredibly flexible and also willing to engage and participate, which I know has not always been the case with the work. And so I think that just speaks to where we are as an organization, that is the response and the attitude that departments that have not historically been involved or interested in engaging in this way, the position that they're taking. So the equity action planning process will start in January in terms of timeline. Departments will receive their results after the baseline report has been completed and submitted to the administrator's office. And then those equity action plans per the equity resolution will come back to the board for ratification. The purpose of this is so that the board has a very clear picture of where we are in terms of equity operations, but also speaking to the initial point in my presentation regarding data-driven decision-making, so that there's transparency within the organization about where are some things that we where are some areas that we need to grow and stretch, where are some places that we have some best practices that we need to share, and where are some spaces that we need directed support. Because I think that creating requirements for departments also requires that there is tangible support from the board to implement those actions and those activities. About a year from now, provided everything goes well in terms of board approval for equity action plans, we'll be back into the evaluation component of the ongoing equity assessments. So moving outside of the equity assessment process, I would like to speak to one of the newer initiatives of the office. Some of the commissioners are already aware of this work happening. For some of you, I'm sure that it is new. In June of this year, the Equity Office launched an exploratory committee on reparations. Part of this was driven by some of the community discussions regarding equity operations, some of the community discussions that happened regarding COVID impacts and what we were seeing in terms of longstanding health disparities that we can tie to the legacy and history of slavery in the United States and deep-seated inequities that we've had as a community and as a country. And so this particular committee is exploring the question. The first year is research, and year two, crafting policy recommendations based upon the research. We have a number of very skilled and engaged community partners of industry area experts coming from the University of Michigan, coming from WCC, from the financial sector, from the legal sector, from law enforcement, all of the areas, from arts and the humanities, all of the areas which would be appropriate to include in this type of space. The committee meets monthly. We're in our fact-finding and research year, and we'll move on into our recommendation year in year two. And happy to talk more about that work for anyone who has questions. And as I mentioned, I think the most aspirational initiative that we're working on. And again, I think this is one that I've discussed with some commissioners, but maybe new to some others, a guaranteed basic income pilot. COVID has exasperated, not created, but exasperated deep-seated inequities. And so much, going back to the research study that was done was done in partnership with the University of Michigan and Family Empowerment Program. So many of those inequities we could tie directly towards financial resources, or negative outcomes we could tie directly towards financial resources. And when we look at things like ongoing issues with violence in our community, poor outcomes for children, compounding health inequities, it is impossible to detangle the impact of poverty on those specific indicators. And so in partnership with the Office of Community and Economic Development, the University of Michigan Poverty Solutions, we're looking at a guaranteed basic income pilot. 600 households at $600 per month over 5 years, looking at roughly a $25 million investment in terms of cost and maintenance of the project. We've seen some wildly successful examples of guaranteed basic income across the country, and want to duplicate and expand some of those efforts in our community. Ideally, we're going to target a community that has had longstanding generational poverty. And at this time, looking at the Sycamore Meadows, MacArthur Boulevard, Danbury Green area. So moving out of our guaranteed basic income pilot work, speaking again to the Equity Liaison program, which recently launched as in response really to staff requests for community engagement, cultural engagement. A lot of the equity work is really heavy stuff. If you have spent more than 5 minutes talking to me, you'll know that I am a data-driven policy kind of person. And some of the feedback that we received internally was from staff saying, yeah, that's great. And that's really important. And also we would like a space that isn't just about that, where we can kind of share some experiences, create cultural engagement, cultural competency, maybe ask some questions that we would like information around, but don't necessarily feel like we have a safe space within our departments, and would like to create that space together. So we have more than 25 members from across county departments, a mix of union and non-union staff. Crystal Campbell in my office is leading that work. I sat in on the first meeting and I'm very excited about what that space is going to create and generate. So that takes us to the end of my presentation. Let me stop screen sharing. And I am happy to answer questions and provide information about any of the things that I covered.
Thank you, Elise. Great presentation. We've got some questions coming up, so I'm going to start with Commissioner Labar, and then it will be Commissioner Sanders.
Thank you, Chair. Elise, thank you for the presentation. You've been remarkably busy, and salute the effort you put in so far. I just had a quick question on the universal basic income pilot potential. As we talk about that as commissioners, I think that's both a policy issue that can be applied in the context of racial equity, but is also a policy issue that can be applied in broader economic context. What would you suggest as to our answer why that would be an initiative of the REO rather than OCED? I think there are plenty of reasons to say one or the other, but I'd like not to say something that staff doesn't feel is accurate in terms of talking about that. hopefully that word salad I just threw at you made some level of sense, but I can restate the question if you need it.
No, that's an excellent question, Commissioner LaBarre, and one that comes up a lot in talking about guaranteed income or universal basic income. Is this something that we're talking about in terms of race, or is it something that we're talking about in terms of economics and class? So I think that one, I would say that while the REO has a mandate specifically related to race, we do look at holistic equity impacts. And so the work that we do is really about holistic equity across the county. And so the guaranteed basic income pilot in this context, we're looking at poverty disruption. And while in Washtenaw County, poverty can be and is often tied to race, it is not exclusively structured in that way. And so from the perspective of a commissioner, I won't, design to speak for you, but I will say that when we're talking about a guaranteed basic income pilot, we're talking about poverty disruption.
Okay. That makes sense. And I look forward to that. I think that's got a lot of potential in both contexts. And I'm glad, frankly, that just society-wide, it's getting, instead of an eye roll look from a lot of entities, a real and honest look. So it's good to hear, and looking forward to be useful and helpful on that. So thank you.
Commissioner Sanders, I see a hand.
So is the 5 mil does that equate to 5 million a year for 5 years?
So $600 at I think it's 22 million in terms of the cost of the program, and then another $3 million in terms of administrative costs to make sure that we have some space for families that may potentially move in and out of the program, because part of the reason we're looking at Sycamore Meadows, Danbury Green in that area is because we have project-based, this is probably going a little bit off into the weeds, but those are HUD sites, and we don't want to disrupt the subsidies that families may be receiving for housing or food stamps or other kinds of like Medicaid or other kinds of subsidies. And so other projects that have done this successfully in other places have partnered with HUD to receive a waiver so that that income is not actually counted against their project-based subsidy. So that's part of the reason why we're looking at that area and how we've gotten to that number.
I have more questions, but I'll follow up later.
Okay.
Next, I see Commissioner Hodge.
Commissioner Scott had a hand before she got booted off. So if she wants
okay.
to, go before me.
Commissioner Scott.
Thank you, Chair, and thank you, Commissioner Hodge. I still do have some questions. Thank you, Elise, for the presentation. I also love data. As anybody knows, I'm always about what we can do with the data. So I have questions about the surveys. One,
yes.
Can we get copies of all the different iterations of the surveys to see what they look like?
Like hard copies or a
just
data
email,
copy?
email,
Yes.
data copy. Yeah. Okay. And then the second, because we want to use this data as like decision making, did we get input on survey design and how the surveys are designed to make sure that they're reliable and validatable?
So that's a good question. We used the Michigan Department of Civil Rights as our template for the process. So we didn't go external for that, other than we'd already been working with Michigan Department of Civil Rights to build out and design a process. So I would not say that we are following their methodology completely, but I would speak with confidence in saying that we're using best practices.
Okay. I'm hoping that what we could do is take those surveys then and then re-administer them after different interventions to see how it changes the tenor of things. And then hoping that we have a way to codify, when you do like surveys like this, they get coded, you've read all the papers with this stuff too. So how those answers get coded and how we can use those things as markers for the future. And so I'm going to assume, but just ask to be sure that we have a method in place for coding these survey responses.
You are speaking my language. Yes. Yes. And the part of the design for the first process was, how are we going to duplicate this in 6 months or a year or 2 years or 5 years? Because if, we can measure a point in time right now, and that's great. But if we're not measuring after interventions and after we've operationalized some of the equity plans, how is that useful in terms of our overall systems and structures? So yes, the plan around this is to duplicate these surveys in the future.
We're clearly speaking each other's love language, because like I have like after interventions on there. So like we're like, it's heart talk between us here. So thank you. The final question I have is like, I appreciate your desire to try to keep individual department data private, so people don't feel vilified or targeted in any way, and allow them to do that work without the kind of heaviness that comes in that. I have a little bit of a concern about what we do if anybody FOIAs that information or asks for more government transparency there. So that was my final question and concern.
So we're keeping the records in such a way that if they need to be FOIA'd, they can be. But my guidance around the process would be that we initially treat the information as confidential to the department to encourage transparency.
Great. Elise, thank you very much for the presentation. It was very informative. I'd really love to read the white paper and the study that was done earlier. So in addition to the surveys, just satisfy my inner geekiness and send that to me too. That would be great. And thank you so much. Thanks for answering all my questions also. Thank you, Chair.
Thank you, Commissioner. Now, Commissioner Hodge.
Thank you, Chair. Commissioner Scott, I do recommend the white paper. I actually referenced it in something for one of my classes recently, so it's good stuff. Elise, thank you for the presentation, and thank you, Crystal, too, for all the work that you've done. It's an impressive amount of work, especially as you said, like the team is really, it's a mighty team, but it's a small team. So first I wanted to underscore the huge impact that the large mass distribution had. I saw a lot of that in my district, and Crystal was really helpful in having me get 30,000 masks. Conceptually, I didn't know what 30,000 masks were going to look like, so that got me in a little bit of trouble. My wife came home and I had 30,000 masks in the house, but I spent a lot of time getting those out, and that was really effective, and people are still using those. So thank you for that. And the question I have is, you set out, you've already done a ton, and it's really hard to believe how much you and Crystal, really small team, have been able to do, and you have a really ambitious set of goals for the next year or so. Is that assuming the size of the office is the same, or is there, like, what would change if the office were bigger? Because I remember this before my time on the board, but the initial plan for the racial equity office is that there were additional staff positions that were going to come out over time. Pandemic slowed that down, I understand. But how might the timeline of some of those projects look different if the staffing was where it's supposed to be?
So I think that the equity office is a small but mighty team of 2, but we are part of the administrative team and experience a ton of support. None of the work that we do would be possible without the collaborative nature of the administrative team, and fundamentally the support of the administrator in making these things happen. So I want to highlight that from the top. I think to your question around expanded staffing capacity, I have a lot of priorities that I think from an equity perspective, before we would start talking about expanded staffing capacity in the equity office, I would want to see full MAG implementation for the organization, because that's been outstanding longer than this work has been going on. I think after that happens, it could be a conversation to revisit, but that would be in terms of an equity priority for the organization where I would be directing resources first.
Gotcha. So what I'm hearing you say is that the timeline is assuming it's the 2 of you. Mm-hmm. Okay, cool. All right. Well, thank you. And thank you too, Crystal.
Thank you, Commissioner. Commissioner Schenk.
Thank you, Chair. I want to thank you, Elise, for all of your work and for your presentation tonight. And I've appreciated as Chair having a monthly meeting with Elise representing the Racial Equity Office. And it's been invaluable to me in the work that I've done through the board, because I find that the advice I get or the input that I get is always useful and always helpful. And so I think I've also come to ask questions that have nothing to do with equity at times, because we have such a great resource in Elise and Crystal, who I was very sad when she left, being the board communications and operations manager, but very glad that she would be in a position that I knew was closer to her heart, and that she would be excellent in. So the advice from the Racial Equity Office has been invaluable in navigating issues of the pandemic, and then also in working on issues in my district, particularly Northfield Township. And so I wanted to express my gratitude. I think, whatever I can do to help further the work of the Racial Equity Office, I'm very happy to do, because I can see the value that you've brought to our organization and to our community. And I could go on and on about all the great things you do, but I'm not going to, because we heard a lot of them. And I'll just say thank you very much for all your work. Appreciate being able to work with you.
Thank you, Commissioner.
Commissioner Beaman.
Thank you, Chair. I also just want to echo the thank you for all of this work and all of the collection. Like yourself and Commissioner Scott, I am a big data geek, and so if the information can be shared, I would truly appreciate that opportunity as well. And just want to thank you for guidance that you've given me, as well as we've had issues in my district.
I think that may have concluded Commissioner Beaman's thoughts. She might have got it all in there.
In this lane area, but other areas as well. And just, I really appreciate all that you do and all of the input and feedback that you give us to keep us on that compass with racial equity in mind when we make our decisions as a board. So, thank you for all this, and I look forward to a continuing as we move forward and just seeing the whole process of the surveys and everything unfold. So thank you.
All right, I think that may conclude this. The stream may have caught up there, so I think we're good on Commissioner Beaman's comments. So I'll apologize for the technology issue there. I see Commissioner Jefferson.
Thank you, Chair. Good evening. Yeah, I wanted to say thank you. One of the things when we were thrust into dealing with COVID that was absolutely appropriate, but unexpected, the uses of the racial equity officer in the manner that it was used, with the passing out of masks, dealing with making sure that we had testing sites in our low income areas. That was a thing that happened. I don't know if any other department or staff would have been able to, have people that they could utilize for that. But the racial equity officer came at the appropriate time and stepped in and took over in the way of making sure that the community had resources and could get through the pandemic as smoothly as possible. It was good timing for this office to come in. I appreciated the fact that that was allowed to happen. And also, it was something to bring the racial equity office in and have that equity lens actually be a part of the process of departments and county operations when it comes to dealing with program services and even with labor. Those type of changes within this organization are difficult because that is a challenge to all of us in our hearts and minds, the way we think and feel about life and what we believe and what we were taught to believe about each other. And those things are difficult, but what I'm seeing here with your presentation tonight, Elise, is a very thought out plan that navigates through as many bumps and as many barriers of intellect and emotional possible things that could have upheavals to bring about resistance of this change. But the goal of the change is to make a better county operation and a better county community and our connection with the community as far as knowing what is the racial equity lens when it comes to distributing resources. That being something that brought about quite a few things within our meetings and within our things that we've done. I mean, you add the opportunity index, you got another tool that does these things. Now your survey is your community survey. I know we don't have I don't know if I have a copy. I may not or may have, but I just wanted to be sure that I'm wondering if the names that people fill out, if they do fill out their names, and do they fill out, I guess, their names with their question, with the answers to their questions to the survey. I just wondered that because it can help. It can have a effect of people not willing to do it, and if their names are attached to it. Is that something that is there name recognition or not? Oh, you're muted.
I was muted.
Yeah.
I almost got through the whole meeting without trying to speak on mute. So yes, we are collecting people's names attached to their responses. And this was one of those things I went back and forth on for a while about, do we collect this information or not? Fundamentally, we want people to provide responses that are honest and transparent. But unfortunately, we've seen some examples of activities out in our community and in public meetings. This body has experienced some cyber mal attacks, and I didn't want to encourage any of that in the survey collection. And so if we left it anonymous, I was concerned that we were going to receive results that, one, were not from people in our community, and two, were not actually representative of people in this community, and that we would receive responses that were hateful and not actually based on people who live in Washtenaw County.
Okay, I see your logic in that. That is unfortunate that it has to be done that way. I mean, it's real. It's a real issue what you're speaking of about the cyber attacks, but it has to be something that you consider to be careful with what we're going to receive, and with the survey being, I guess, more genuine. So I understand that. Thank you. But really, you and Crystal have, I don't know how to say it. You have resilience and also tenacity to speak up in situations that could, go to left field, but you both have handled them real professionally. And I want to thank you for the work that you did with the pastors also, and those who continue to work with you, and how you've created relationships in the community with certain neighborhood leaders and community leaders, which is a big plus when we start dealing with our reputation as a county to be equitable. So thank you for what you're doing, you and Crystal.
Thank you, Commissioner.
Thank you. Go around and make sure I didn't miss anyone. Do not think I did. I think we're good there. Elise, first off, again, thank you for coming into working session tonight. Appreciate it. I have a question about the Opportunity Index, a product of OCED. And you've had so much on your plate since you've been our equity officer with COVID and other initiatives going on. But I'm just curious if you've had a chance to think through any changes you might want to make for future opportunity indexes, whether there are things you might want to include or subtract or any adjustments to it. It's become a really important tool for us as we analyze what we're doing, and would be curious if you've had any thoughts about that.
So I have a lot of thoughts related to the Opportunity Index. I think that there are several ways we can grow that tool and make it better. I think when it was initially designed, it was designed for a different purpose than how we're using it now. And so how we're applying it now in terms of board action and county department resolution and measuring kind of some impacts, I think that there is a great deal of potential in terms of how we can use that as a tool, but it should not be the only tool that we use in terms of data-driven decision-making, because it's just not designed in that way. So I am excited to work closely with OCED around the Opportunity Index and how we can grow and make it better. I know that speaking with Teresa Gelati, there are already some things that she's identified in terms of ways to make some modifications around how we can use the Opportunity Index. That all being said, I do think that there is exceptional value in it as it stands. I think that as we're looking at high and low opportunity areas in the various categories attached to it, in addition to things like the CDC social vulnerability scores, in addition to some of the other data and metrics that the county collects and utilizes, there's an opportunity for comprehensive pictures in terms of where we stand as a community. But I don't think it is an end-all be-all tool. And I think there's a lot of room and ways that we can help make it grow. And I'm excited to help support that work.
Great, thank you. I appreciate your comments. I very much agree with that perspective. So I just want to do one more look around to make sure nobody else has any more comments or questions. And seeing none, again, Elise, I want to thank you and Crystal for your work and for this presentation this evening. Very much appreciated. We will move on to items for current or future discussion. Seeing none, we'll move to pending items, which I do not believe we have any. Takes us to adjournment.
I'll move to adjourn.
Support.
Move to adjourn has been supported. Commissioner Dill waves hello. We appreciate him for checking with us after his other commitment this evening. And with that, we will stand adjourned, and we'll see everybody 2 weeks from now for our next working session. Thank you.
All right. Enjoy your evening. Take care.
Good night.
Bye,
Bye,
everyone.
everyone. Good night. Bye.